Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Abnormal glucose homeostasis. So the individuals without the diabetes have an abnormal glucose homeostasis. So the people without the overt diabetes, they have the abnormal glucose homeostasis, and it is also called the pre-diabetes or intermittent hypoglycemia. So it is the pre-diabetes or the intermediate hyperglycemia. So these people are at increased risk of developing the diabetes mellitus. So they are increased risk of developing the DM, that is diabetes mellitus, and three categories of abnormal glucose homeostasis have been defined. So there are three categories which are defined. So first one being IGT. IGT stands for the impaired glucose tolerance. So impaired in the glucose tolerance. And here the blood levels are between 140. It is between 140 and 199. And this is mg per dl. Following an oral glucose challenge. So following an oral glucose challenge. Next is there is IFG. So this IFG, it stands for the impaired fasting glucose. So impairment of the fasting glucose. So this fasting glucose is between 100 to 125. So it's 100 to 125 mg per dl. Next what we have is HbA1c. So this HbA1c is basically 5.7 to 6.4%. To learn and grow daily like this, please do subscribe.